Okay, on behalf of Santa Barbara City College's Earth and Planetary Science Department and the Security Division of the campus here and of the administration, I'd like to welcome you here for a class designed to help you guys in the event of an earthquake. So this is part of the earthquake drill. And one of the things that's paramount is coming up with a way to teach you how to learn something that's very usable in your life. And of course, if there is a disaster, being able to deal with people being hurt, students being hurt. And as a parent myself, we've got all these kids here that, you know, parents are assuming that we're going to take care of them. And so I'm going to teach you guys how to do just that. Start Triage was developed by the Newport Beach Fire Department years and years and years ago as a means of being able to save lives. The key here is how to assess an injured victim under 1 minute. Number one. Number two, how to use bystanders or people that aren't severely injured to be able to assist in the rapid treatment of severely injured patients. How to use what's called RPM for Start Triage. And in the event that we have triage tags, then you would understand what those mean. There's 4 categories of colors that we use to denote various levels of injuries we'll discuss. And the start is the answer to the rescuer, us, for what do I do now? Something as bad has happened. What can I do to make a difference in somebody's life? Now, in real world, my assessment as a fire captain paramedic, retired, when I did this for a living and I just retired, it takes 15 seconds per person to do this thing called Start Triage, where we go into a bus accident with 40 victims. Within less than 5-6 minutes, we've got a pretty good idea of who goes first, who goes second, and we could do simple things that will make a difference in saving somebody's life. So directing walking wounded away from the scene to reduce the number of people will be the first thing. So here's how it works. Start Triage uses 3 things that three things you're going to remember: color coding, black, red, yellow, and green. It uses RPM, which stands for respirations, perfusion, and mental status. RPM, respirations, perfusion, mental status. And then the acronym or the number is 32 can do. So everybody say RPM. RPM. Everybody say respirations. Respirations. Perfusion. Perfusion. And finally, mental status. So the numbers that correlate with that is, everybody say 30, 32 can do. So here's how it works. We have this incident that occurs, and the first thing we're going to do is, everybody that can hear me, I want you to walk over to that tree. So if you're on the highway, you know, I want to get you off the highway and we've got a bunch of people walking around, the walking wounded, maybe they're not hurt at all. I want you to go over there. And so what happens is the majority of people go, okay. And they go walking. Okay, now I'm left with just the people, reducing the number of people that I'm going to have to assess. Okay, because they may not be able to follow commands, or they're injured and they can't get up. So when you use the Start Triage, it starts where you're standing. The first person you come across, you then go for R. R stands for respirations. So the first thing is, are they breathing? Okay, so if they're not breathing, it could just be a matter of repositioning their airway. So if you reposition their airway, and I'm not getting into any difficult emergency medical procedures and training and whatnot, this is just very, very basic stuff. So if we can reposition their airway and they start breathing again, then that person will be what's called a red tag. Okay, they'll have a red tag attached to them because there was a reason why they weren't breathing, and I'm going to make sure that they're evaluated and assessed as I build this medical organization and we get the ambulance coming in, you know, things like that. Continuing for respirations, the 32 can do. 30 means that if they're breathing more than 30 times a minute, and what's normal breathing? Between 12 and 20, give or take, okay? If you were to count your respirations, okay? Between 12 and 20 is normal. And you could tell that's over 30, okay? So something's going on. And you can now equate to watching a soap opera or actually seeing somebody that's hurt and know that something's going on. And you've been in pain before, okay? Oh boy, something's wrong. Over 30, that's an immediate red tag person. If it's less than 30, it's normal then. Awesome. Next thing is perfusion. How are they perfusing? And the thing that we use for that is the nail bed. So I want you to take a look at your nail bed and I want you to pinch it, hold it, okay, and let go. How long does it take before it turns pink again? Less than 2 seconds, okay? 32, 2 seconds or less, you're normal. But if it takes longer, what's happening is your body knows that the heart needs oxygenated blood, your lungs do, your kidneys do, your brain does, and so it starts shutting down your distal circulation to kind of shunt it and protect the core, okay? So it's shown by just not that, but if you pinch the top of your skin and it stays up, it's called tenting. If you look at the veins on top of your hand and they stay flat, just visually, that's called dorsal venous collapse, venous like a dorsal fin, okay? And then cold and sweaty and the pale color, I mean, these are things that you can see. So the perfusion, is there a radial pulse absent? Uh-oh. Maybe they're bleeding, so you might be able to do something just to control bleeding right then and there. So possibly, and by the way, when people do get hurt, if this is my lady here, okay, I'm not going to leave her. Trust me. You tell me to go wherever you want, sure, right. I'm staying right here. So if she's bleeding, okay, then, and I'm not hurt, and somebody comes and says, okay, I want you to put direct pressure, okay, that alone could save somebody's life, okay, direct pressure. So, but then again, if they, control bleeding, they're going to have to go to the hospital too or get medical care very quickly, okay, so that's a very important consideration. If the radial pulse is present, then, and they have good pulse, then you go to the mental status. Can you follow simple commands? What's your name? What day is it? Can you go, or they couldn't follow my directions to go over yonder, okay? Then there's a problem with not being able to follow simple commands or can't follow it. If they can't follow any commands, they're an immediate. If they can follow simple commands and they do have broken bones and whatnot, they're delayed. Okay, I'll get back to you. Okay, I need to take care of the people first. So your priorities here are to find the most likely people to die. Okay, and we've identified that, and then bringing some sort of medical organization to the scene. So what we're going to do now is, this is all the training you get. I'm now going to assess you. Many people are teachers here. 4 steps of teaching: motivate, prepare, apply, and evaluate. Now we're going to apply it and evaluate at the same time. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You get a number yet?
No.
1, 2, 3.
They're leaving.
And you're good. Okay. All the 1s go over here. All the 2s over here. All the 3s over here. All the 4s over here. All the 5s over here. Quickly, quickly. Get your teams together. Get your response teams together. Okay, I now want you to respond. We've had an earthquake.
Where's the 3s?
We have her.
3s are right there.
She's a red tag.
Okay, I want your groups now to go assess those patients. You've got 5 minutes. 5 minutes. So your patients are on the lawn over there. I want you to find out whether they're a red tag, a green tag, or a yellow tag, or a black tag. Respond. All the victims are over there, the kids that are under the tree. And they've got cards, and you're going to be able to find out what the vitals are based on RPM. It's that simple. So just head over that way, and you could you know, get your leaders.
I know you can. Her away a little bit. Bottom line is, she's still not breathing. We're gonna do a head tilt chin lift real quick. If she starts breathing, all we need to do is just place her like that, or get somebody to hold her airway open. If she doesn't start breathing with that, she's a black tag, and we move on, and she's dead. Yeah. Do you start breathing when we open your airway? Then you're black tag, and she's dead. If she was an isolated person in an accident, and if she was only one, we'd be working on her. But we can't work on her because she's not breathing, so she's dead. We just move on. Black tag and move on. Where's her card? Yeah, well then get a card. Oh, there it is, right there. Here. Oh, let's see what it is.
Oh, you got the disease.
Oh, no respiration. No respirations, no pulse.
No pulse, no response. So she is?
So no water, well, no, but she's not breathing. So the one thing you can do is you can try and open her airway.
Yeah.
And see if she starts breathing.
Okay.
If she doesn't start breathing, she's dead.
Okay, you don't do mouth to mouth.
No, we don't have time. No, because it takes too long.
Okay.
No, you should be able to triage all these people in about 5, maybe 10 minutes.
Oh, really?
Because here's the problem. If I spend a whole bunch of time with her,
you're wasting it.
Well, I'm wasting it, but the problem is if that person way over there, all they needed was their airway open, and it takes me 20 minutes to get there, she's dead. Yeah. Okay. I want to get there as soon as I can so that I can't, and then I'll come back and work with them later. Yeah. That's why it's so important to start off with anybody that can get up and walk, get out of here so we don't have to trip.
So we don't mess with it.
Yeah, you could walk out with a broken arm. You could be missing a limb. If you can get up and walk, you're a green tag. It doesn't matter what it is. Green. That's minor. Because you could be missing your arm and walk out and be a green tag. The reason being, you're following commands. It's rare that that would happen, but the point is, they're out of the scene. We'll reassess them later and figure out there'll be a red tag, but you can't. The best people to do triage are people exactly like you. Do exactly as you're told to do. The worst people that triage are doctors, paramedics, and nurses, because we put too much effort into it. We start, oh, we can do this, and we can do, and it takes too long. You want to just get somebody who just follows the script, and that's it. Who else do we have? Yeah, just to triage and figure out what's going on. Sure, triage plays a part in every accident. There's more than one person. Oh, he's a walking person? Yeah, you walked? You're green. So what did we figure out over here? What did you guys figure out over here?
Well, he's bleeding, so I'm giving pressure.
Good.
I'm not leaving.
And you can have him hold pressure on it too. It doesn't really matter.
Well, but he can't follow commands. He can't follow commands.
So what is he?
So we're about immediate.
So he's an immediate, right?
Yeah, he's immediate. He's immediate. He's immediate.
Yep. As I told them over there, the important thing to understand is that they can follow commands and get up and walk, they're a green tag. It doesn't matter whether they're missing an arm. They're still a green tag. It doesn't matter. As I also told them, the worst people to do triage are doctors, paramedics, and nurses. Because we always want to do more. Huh?
What's that?
What?
If he's pee, it's 6 seconds.
Okay, so that means his circulation is poor, so he's a red tag. We don't even have to go any further. Okay. As soon as you reach that point, you're done. You move on to the next person. I don't even care what his level of consciousness is anymore. He's breathing, but his circulation is more than 2 seconds. He's a red tag. You move to the next person. That took what? 15 seconds to do?
Yeah.
And then we move on to this guy. Okay, 2 seconds, he's breathing, but he can't follow commands. He's a red tag. Move on. You tear off the red tag thing. Real triage tags have a way to tear off a thing and throw it on top of them, and you tie it around their arm or their leg.
Something's happening on campus. We don't have any tags. How do we keep people from being triaged over and over?
Well, they're going to constantly be re-triaged, but the thing is that triage tags definitely help. But the other thing too is if there's only like 4 or 5 people, you can sit there and go, okay, remember he's a red tag, or you can, mark him somehow.
We just have to figure out a way to mark.
Right. The best thing to do is to get triage tags. That would be the best for sure.
We need them in our emergency kit.
Yeah. Oh, absolutely. Yeah.
Okay. In our safety bags, we have masking tape.
You could sit there and do that. Sure. You could put red, green.
Yeah.
Well, green will be easy. Just anybody that walks is green. So.
The masking tape.
That works. But the better thing to do is order some triage tags, so you can tear off things and you can track who you have. The biggest mistake people make when they triage too with the triage tags is they tear off the tags and then they throw the part they tore off on the ground. You need to keep that with you so that when you go back to the main tent and say, look, you can pull out all your tags and go, look, I have 35 patients.
Register them.
Exactly. So you got to keep those tags with you.
Look, he's all better.
These guys will get this whole lecture here when we start triaging in a few weeks.
Okay.
So.
They're twins, so I would think
Yeah, it's okay.
to be an organ donor.
Yeah, which one's older? Okay, so we're going to save him. And
Organ donor.
The eldest always gets the best.
11 minutes.
They pay the most taxes.
Hardly ever see you out here.
Okay, student victims. How did it go? Were they accurate in their assessment?
Yes.
Was there any problems? No. Okay, people that actually did the triaging and you actually used the information in your cheat cards. Did you have any problems? No problems? I talked to one lady that had to leave and she said, I'm a little confused. I go, what's that? And she goes, well, people weren't doing what I told them to do. It's just like having a class at City College. It's like herding cats sometimes. Okay, so it could be a little bit difficult. And if you're dealing with somebody that's hurt, you're assigning somebody to stay with them, you're doing your best to be able to, assess people and do what's necessary to save a life. So with the skill set that you've just learned and with your refresher card,